Hello and welcome to this National Pathology Week video. My name is Dr. Susie Lishman and I'm President of the Association of Clinical Pathologists. This series of videos on pathology myths and misconceptions was recorded as part of National Pathology Week 2024, an annual celebration of the vital role that pathology plays in everyone's healthcare. It was developed by the Pathology Alliance, an umbrella organisation of all of the UK's pathology societies and organisations. In this video, Dr. Amy Belfield will explore the statement, "Taking antibiotics can't cause any harm."
So I'm Amy, I'm a specialist registrar in infectious diseases and microbiology and a trainee representative of the British Infection Association. So thank you for asking us to talk today. So I've been asked to speak about the myth of antibiotics cause no harm. Next slide, please. So you might all be familiar with this quote from Hippocrates. He discusses how it's a doctor's duty to do good and to do no harm. And it's definitely true that antibiotics can do a whole lot of good. And since the discovery of penicillin in 1928, many millions of lives have been saved. However, spoiler alert, if they're not used correctly, and sometimes even if they are, antibiotics can and do cause harm. So next slide, please. So let's say a patient comes to us with a viral illness such as a cold. They're adamant they want antibiotics because the last time they were given antibiotics, it cleared up very quickly. So what could the harm be for giving them, I don't know, a 5-day course of amoxicillin? So first, let's look for the possible consequences for this patient. I've listed them here and separated them between side effects, allergy, and other. Next slide, please. So here's the side effects for amoxicillin. So all antibiotics, even when used correctly, so right patient, right time, have side effects. And these could be common. So in this instance, sort of diarrhea and vomiting, and you could say they're unpleasant but manageable. But what about thrombocytopenia? So that's low platelets, or leukopenia, so low white cells. That feels a little bit more significant. So if the patient needs antibiotics, then you can be mindful of that and give them. But if they don't need them, it's a bit harder to say, well, I'm happy to take this risk of causing you harm. In addition to that, antibiotics have a lot of other potential side effects, for example, when people are pregnant or breastfeeding. And so there's potential harm to fetus in that instance also. Next slide, please. So moving on to allergy, this is also taken from the BNF with regards to amoxicillin. And so everyone has probably heard of allergy, and that is an immediate reaction which can range from a rash to angioedema, which is facial swelling, to anaphylaxis, a life-threatening reaction which can cause airway compromise and shock. So that feels like quite a big risk to take that you don't need to take if somebody doesn't need antibiotics. Next slide, please. So I've skipped ahead, shouldn't have said next slide. So the other risks were the third ones that I mentioned. Thank you. I kept these separate as they're slightly different to side effects and allergy, but there is a bit of a crossover. So this is a risk of developing other infections through exposure to antibiotics. So these are examples of these, such as C. difficile, which you might have heard of, or MRSA, methicillin-resistant Staph aureus. So we'll take those individually. C. difficile infection is a bacterial gastrointestinal infection, and the C. diff bacteria themselves are quite resistant. So if you give somebody, say, amoxicillin for a lower respiratory tract infection, or when you're not meant to, the antibiotics can disrupt the gut microbiome, but the C. difficile spores survive, and then the C. diff bacteria replicate. They get a bit of an advantage. And this can cause a mild sort of GI upset that needs treatment, but it can also cause a life-threatening colitis, and which needs additional treatment, including additional antibiotics. So the next one that I mentioned was MRSA, so methicillin-resistant Staph aureus, and that's a resistant strain of a very common bacteria called Staphylococcus aureus that's found to have an association with exposure to antibiotics. And the issue with this strain is that it's very resistant to flucloxacillin, which is a commonly used antibiotic to treat skin and soft tissue infections. So it's harder to treat than your standard. And finally, the other risk that I wanted to mention is antimicrobial resistance, which is when microbes develop resistance to antibiotics or antimicrobials as a whole. And we're going to look at that in more detail later on. Next slide, please. We got there. So now, if we zoom out a little bit more, so go from the microscopic to the not quite macroscopic, the potential harm that antibiotic use can have on healthcare systems. So not just the individual, but what about the NHS and other healthcare systems as a whole? So this sort of really narrows down on getting the right antibiotic to the right patient at the right time. So to reduce the spread of infections within healthcare systems, there are infection control teams, and these are usually led by a microbiologist or by an infection specialist. And these teams help with the investigation and management of patients with communicable infections, i.e. infections that can spread. And they help determine all sorts of things. So they help with side room allocation, personal protective equipment, about ventilation, about cleaning procedures, and they help manage outbreaks. So many of the infections they aim to control are due to infections that we've mentioned, but also respiratory viruses and multi-drug resistant organisms as a result of antimicrobial resistance. So to manage these infections, resources of healthcare systems have to be used. And this can in turn impact patients directly and indirectly. So directly, that can be the spread of infection to the patient in the bed next door, or it can be indirectly, i.e. using resources which cost money, which means less resources to manage other conditions. And this can be the cost of antibiotics. So, for example, to treat MSSA, so methicillin sensitive Staph aureus, it can cost about £2.21 ish for a week of antibiotics. Whereas for MRSA, a vial of the antibiotic to treat that can cost £11 for one vial, and you can need 14 to 28 of those. So quite significant costs there for treatment, as well as for the resources of rooms and beds and PPE and nurses, etc. Interestingly, in addition to this, a recent review has found that areas of deprivation have a higher antibiotic use as well. Next slide, please. And next slide, please. Thank you. So the global picture in the elephant in the room is antimicrobial resistance, and that's when antimicrobials are no longer effective to treat an infection. And this happens naturally through evolution, but the use of antibiotics adds a selective pressure. And according to the World Health Organization, AMR is one of the top 10 global public health threats facing humanity, with antimicrobial overuse and misuse being the main cause. And in 2019, it's estimated to contributed to 4.95 million deaths globally. So our job in medicine in general, but in particular in the infection specialties, is in antimicrobial stewardship. And that links into us to be smarter about our use of antimicrobials. And this slide just shows the One Health perspective on managing antimicrobial resistance. And that recognizes the interconnectedness of animals, humans, and the planet, and therefore brings together sectors from vets to farmers to management of motorways, etc., to help mitigate antimicrobial resistance. Next slide, please. So they're my references, and next slide, please, also. Sorry, there's one missing. So the bottom line is that antibiotics are incredible and life-saving medications, but it is in fact a myth that they cause no harm. And our role in medicine is to ensure that we use the right antibiotic for the right patient at the right time. So thank you.
I hope you enjoyed learning the facts behind that myth. You can see more of these videos on the Royal College of Pathologists YouTube channel at I Love Pathology.